Welcome back to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to drive better patient outcomes. This is episode 8 of our 10-part series on case management, and today, we are asking a tough but important question: why do so many case management programs fail? Hospitals and healthcare organizations invest time and resources into case management, yet many programs struggle to produce meaningful results. What is holding them back? Is it a lack of training? Resistance to change? Or simply not having the right support system in place? The reality is, barriers like resource constraints, knowledge gaps, and systemic challenges can derail even the best-intended case management efforts. But here's the good news: these obstacles are not insurmountable. In this episode, our hosts, James Carter, BSN, RN, an ICU nurse, and Emily Ramirez, MSN, RN, a nurse manager, will break down the biggest reasons case management programs fail and how to avoid them. How to overcome resource limitations, lack of training, and resistance to change. Why systemic changes and leadership support are critical to long-term success. They will also discuss insights from Dr. Nicholas Abella's article, which highlights how nursing teams and healthcare organizations can build sustainable, effective case management programs that truly improve patient care. And as always, we will leave you with an actionable takeaway: survey your team to identify the most pressing challenges in case management and develop targeted solutions. The difference between a failing program and a thriving one is strategy and execution. Let's explore how to make case management work for you.
Welcome back to the Healthcare Nurses Network podcast, where we really try to give you the tools and knowledge you need to thrive as a nurse.
Absolutely.
And, today we're diving deep into a challenge we all face.
Yeah.
Making case management truly effective.
Mm-hmm.
And we're not just talking theory here,
Right.
but how to make it work
Yeah.
on those crazy busy shifts, improving patient care, and honestly, your own sanity.
Right.
So imagine a world where no patient falls through the cracks
Mm-hmm.
and your team is totally in sync.
That's the dream.
That's what we're aiming for today.
I love it.
But let's be honest.
Yeah.
We've all seen those well-intentioned case management programs that just kind of fizzle out.
Yeah.
Why does that happen?
It's tempting to blame individuals, but often it's the system itself that's setting us up for failure.
Right. Like that study that showed specialists, primary care docs, and social workers all working with the same patient, but not really communicating. It's like a game of telephone where the message gets totally garbled by the end.
Exactly. And that's where the true power of case management comes in.
Okay.
It's about shifting the entire culture towards proactive collaboration, not just sticking a case manager label on someone and hoping for the best.
Right. So it's bigger than just checking boxes.
It is.
It's a whole different way of thinking.
Yeah.
But, let's get real.
Mm.
I hear nurses say all the time, we don't have the resources for this, or it's going to take up too much time.
Right.
What do you say to that?
Those are valid concerns, and it's easy to feel overwhelmed.
Mm-hmm.
But the research actually debunks those myths.
Okay.
For instance, one study found that hospitals using a collaborative case management model saw a 15% reduction in readmissions.
Wow.
Think about the time and resources that saves in the long run.
15%. That's huge.
Yeah.
So it's not about adding more to our already overflowing plates. It's about working smarter.
Exactly.
But how do we actually make that happen?
Well, effective case management doesn't always require dedicated staff.
Okay.
It's often more about maximizing the team you already have.
Okay.
For example, even something as simple as a 10-minute daily huddle between nurses and social workers, specifically focusing on high-risk patients, can make a world of difference.
Okay. So we're talking short focus meetings to get everyone on the same page.
Yeah.
But does that really move the needle?
You'd be surprised. In one hospital, they started these short huddles and saw a significant decrease in patients needing to be readmitted within 30 days. It was a small change with a big impact.
Now that's what I'm talking about.
Yeah.
Actionable solutions.
Right.
So whether you're a nurse leader or at the bedside, you can start implementing these ideas right away.
Yeah.
Let's break it down by role.
Sure.
Starting with nurse leaders.
Okay.
What can they do to set the stage for success?
Well, firstly, training is key. It's about ensuring everyone understands the core principles of case management and how their individual roles contribute to the larger goal.
Right. Because knowledge is power.
Yes.
But it's not just about one-and-done training sessions, is it?
Absolutely not. It's about fostering a culture of continuous learning and open communication.
Okay.
And those multidisciplinary meetings we talked about, nurse leaders need to champion those, even if it's just a quick huddle to address immediate concerns.
That makes sense, creating that sense of shared responsibility instead of everyone working in silos.
Right.
But what about pushback?
Yeah,
You know, this is just another thing on my to-do list kind of attitude.
that's where data comes in.
Okay.
Nurse leaders can use surveys and data analysis to pinpoint the specific roadblocks they're facing.
Right.
Is it lack of communication,
Mhm.
inadequate training, maybe even just resistance to change? Once you know the problem, you can target your approach.
So it's like detective work, gathering clues to solve the case of the failing case management program.
Exactly. And that data also helps you make the case for resources. Show administration how these small changes lead to better patient outcomes and potentially even cost savings.
Okay, I'm really seeing the strategy here.
Yeah.
But what about the nurses on the floor, the ones directly caring for patients? What can they do?
Oh, they're the eyes and ears of the team, and their input is crucial. They need to actively participate in those meetings,
Right.
sharing their observations, concerns, and even potential solutions.
So it's about being proactive, speaking up, and really advocating for your patients.
Yes.
But what if a hospital doesn't even have a dedicated case manager?
Right.
Does that mean this whole thing's a no-go?
Not at all.
Yeah.
Even without a formal case manager role, nurses can embrace the principles of case management.
Yeah.
They can collaborate more closely with social workers, families, and even community resources to ensure patients get the support they need.
So it's about taking ownership, even if you're not officially the case manager.
Exactly.
I love that.
It's about seeing the bigger picture.
Mm-hmm.
Case management isn't about a title, it's a mindset. It's about championing the best possible outcome for every patient.
And that's something we can all get behind, right?
Absolutely. And one of the most empowering things is that you don't need a massive overhaul to start seeing results.
Right.
Remember that specific action from the article?
Oh, yeah, the one about those short huddles.
Yeah.
Such a simple idea.
Yeah.
But I'm starting to see how powerful it could be.
Exactly. It encourages nurse leaders to implement just one small change, like a 10-minute weekly huddle between nurses and social workers, specifically focusing on high-risk patients.
So just taking a few minutes each week to get everyone on the same page can really make a difference.
Absolutely. It's about taking that first step and building momentum from there.
Okay.
It's like that saying, the journey of 1,000 miles begins with a single step.
Right. But what's the next step? How do we know if these huddles are actually working?
That's where data comes in again. Track the impact of these huddles.
Okay.
Are you seeing fewer readmissions? Are patients being discharged with a clear plan and the resources they need?
Right.
Are nurses feeling more confident and less stressed?
Okay, so we're not just making changes blindly. We're actually measuring the results.
Yeah.
That's smart.
And that data is crucial for advocating for more resources or expanding the program.
Okay.
You can go to administration and say, look, these short huddles are making a real difference. Imagine what we could achieve with more support.
That's a powerful argument.
Yeah.
So starting small, gathering data,
Right.
and building from there.
Exactly.
But ultimately, where are we headed with all of this?
Right.
What's that big picture vision for case management that the article talked about?
Think about it. What if we had a healthcare system where patients never felt lost or confused, where communication flowed seamlessly between departments, and where every member of the care team felt empowered to advocate for their patients' needs?
Wow, that sounds incredible.
It does.
It's like a healthcare utopia.
Yeah.
But how do we get there?
It starts with each of us. It starts with embracing that collaborative mindset, seeking out opportunities to communicate and coordinate care, and advocating for those small changes that can have a ripple effect. And it's about remembering that we're all in this together.
I love that. It's not just about case managers. It's about all of us working together to create a better system for our patients.
Exactly. And resources like the Healthcare Nurses Network are here to support you every step of the way.
You got it. Be sure to visit healthcarenurses.net. They've got tons of resources, articles, even online courses to help you stay up to date on best practices and connect with other nurses facing similar challenges.
And don't forget about the Nurses Link Up app.
Right. It's like having a support system in your pocket. You can connect with nurses from all over, share your experiences, get advice, and just vent if you need to.
You can download it on the Apple App Store and Google Play Store.
So no matter where you are in your nursing journey, remember, you're not alone.
Absolutely. And when nurses unite, we can achieve amazing things.
Well said. And on that inspiring note, so it sounds like we've covered a lot of ground here.
We have.
Wrapping up this deep dive into effective case management. I hope you're walking away with some new insights and strategies to try in your own practice.
Me too.
And remember, you don't have to do it all at once.
Right.
Even small changes can make a big difference for your patients and your team.
Absolutely.
Exactly. Start with that one small step.
Yeah.
Maybe it's a 10-minute huddle. Maybe it's reaching out to a social worker more proactively.
Right.
Maybe it's simply asking more questions in those multidisciplinary meetings.
Yeah. Just start somewhere.
The key is to keep that collaborative spirit alive.
Yes.
To keep advocating for your patients, and to never underestimate the power of your voice.
Well said.
Thank you for joining us on this journey.
Of course.
And a huge thank you to our expert for sharing their wisdom and insights.
That's been my pleasure.
And to all our amazing listeners out there.
Yes.
Thank you for being part of the Healthcare Nurses Network community.
Absolutely.
We're here to support you every step of the way.
We are.
Remember to check out healthcarenurses.net for all sorts of resources.
Yes.
And connect with fellow nurses on the Nurses Link Up app. Available on the Apple App Store and Google Play Store.
It's a great resource.
Until next time, keep learning.
Keep advocating.
And keep making a difference.
Absolutely.
Thank you for listening to the Healthcare Nurses Network podcast.